Hi, I'm Becca, and this is my partner,
John.
and we have the injury of frozen shoulder.
So our patient's name is Jessica Brown. She's a 50-year-old mom of 3 who's diabetic. She's a full-time receptionist. She loves to bowl with her friends, but unfortunately she tore her labrum during the championship game. She underwent surgery for her slap lesion on her right arm, and she takes over-the-counter anti-inflammatories for the pain. She developed frozen shoulder due to the immobilization of her right arm. What is frozen shoulder? Frozen shoulder is when the shoulder capsule thickens and becomes tight, causing adhesions to develop due to the immobilization of the arm. Ligaments, tendons, and muscles are also affected by this condition, and there are 3 stages of the frozen shoulder. First being freezing, which the pain worsens and the shoulder loses range of motion. Second is frozen, when the pain persists and the activities of daily living become difficult. Third is thawing, which the shoulder range of motion improves and she can return to full participation. It's also most common in women over the age of 40 and people who are diabetic, and the injury can persist for over a year.
So, some precautions and concern with frozen shoulder. First, we have inflammation. So, this is a picture from one of our articles that we found. Right here is a picture of the shoulder capsule inflamed, and it's all red and swollen. It looks pretty painful. Then we have limited range of motion / hypomobility, so they're not able to move their shoulder very much, can't really flex, extend, abduct very well, and this can lead to a decrease in muscle mass since they're not moving it as much. Their deltoids, their traps, even their biceps can all be affected and decrease. And since the muscle mass decrease, this can also lead to bone disease and fractures, so the bones become weakened, so any movement that she does wrong, or maybe the patient hits it wrong, that it could fracture it very easily. And then also, if the symptoms start to last longer than a year, then they could need surgery for this. And also, excessive pain and malignancy can occur. So we have operative and non-operative treatments. So for operative treatments, there was 2 that we found. First was manipulation under anesthetics. So the patient goes under anesthetics, and then the surgeon will start moving their shoulder, basically manipulating it into different directions to try to stretch that capsule out, and they would have to go under because it would be really painful if they were not. And then the arthroscopic capsular release. This is a minimal invasive surgery, so the patient is also again under anesthetics. The surgeon inserts an arthroscope and a special probe into the shoulder capsule, and the special probe emits a high frequency radio wave that is used to cut and divide that thickened part of the capsule out to kind of help loosen it up. And then for non-operative treatments, you can either take non-steroid anti-inflammatory medicine like Tylenol, ibuprofen, things like that, or they can do steroid injections like cortisone, and that will be directed directly into the shoulder. So if our patient is diabetic, we don't want her taking too much anti-inflammatory medicines that could cause stomach pains. And then last is physical therapy, and usually the anti-inflammatories and the cortisone is paired with the physical therapy. So the physical therapy, they work on the range of motion, joint mobility, they learn how to function day to day, like putting on their shirt again without pain.
So can you guess what treatment we went with? Well, we went with non-operative. Research has shown that surgery is used for the last resort for frozen shoulder. If the condition persists for over a year, then surgery is recommended because the pain is just going to get worse. Also, physical therapy seems to improve the condition because it focuses on joint mobility, function, and range of motion. So in her initial eval, Jessica came in to our clinic 3 weeks after her having her slap lesion surgery. She rated her pain at an 8 out of 10 with a dull and aching feeling. Unfortunately, her insurance only allowed us for 24 visits over a 3-month period. Her range of motion was very limited. Her flexion was 60 degrees, her extension was 20 degrees, abduction was 65 degrees, her internal and external rotation were 40 degrees. Also, her manual muscle test of her rotator cuff was a 2 out of 5. Her ultimate goal was to gain full range of motion and decrease her pain, being able to play in the upcoming bowling tournament that is about 5 months away in Las Vegas.
So for phase 1 is going to be our inactive phase, and it's going to be the first 2 weeks of physical therapy. So our goals here, for the first goal, we're going to want to decrease her pain from the 8 out of 10 to a 5 out of 10 by 4, 6, 17. We also want to increase her flexion from 60 degrees to 75 degrees by the 13th of that month. And even though that's not a lot of range of motion, she's in a lot of pain right now, so we don't want to do too much with her, and she's still a little bit inflamed. And so some treatments that we're going to have to do is first a finger walk up the wall, or you may see like a ladder that they can just walk their fingers up. They just walk it like this. Second is a pendulum swing off the table. So like our picture here, the patient just kind of leans with their uninjured arm on the table, the other injured arm just kind of swings back and forth to kind of loosen it up without causing too much pain. And then we have petrissage for about 10 minutes, so that kneading massage to kind of loosen it up, make her feel relaxed. And then the last 15 to 20 minutes of therapy, we want to ice her to kind of cool it down, relax her from doing all the exercises that we've been doing. So the second phase is going to be our active phase, which is going to be weeks 2 through 5. Our goals, we want to decrease her pain from the 5 out of 10 to a 2 out of 10 by the 20th of April. And then we want to increase her manual muscle test of her rotator cuff to a 3 out of 5. And we also want to increase her flexion and extension to 100 degrees and 45 degrees, her abduction to 95 degrees, and her internal and external rotation to 70 degrees. So some treatment we're going to have her do is get a 5-pound dumbbell in her injured arm, working pronation and supination with your arm extended. Then we're going to do abduction bar swings. So we're going to do 3 sets of 10, so you can get a PCP pipe, a broom, anything, and just kind of do abduction swings. And then we have lateral raises with a 5-pound dumbbell, 3 sets of 8. So just a dumbbell in each hand, just do some lateral raises. And then the last one, an armpit stretch for 30 seconds. So just kind of like in the picture, you just kind of lean on the table and you kind of squat down, and it just stretches out the armpit area.
So phase 3 is the resistive phase, which lasts about 5 to 10 weeks. Our goals were to decrease her pain from a 2 out of 10 to a 0 out of 10. All range of motion should be back to normal by the end of the 10th week, and her manual muscle test of the rotator cuff was a 5 out of 5. Our treatment we used was the underhand ball toss to a trampoline while standing on an RX pad, which mimics the bowling movement, and her standing on the RX pad will help with proprioception and strengthening. We had her do modified push-ups, kettlebell swings for her flexion, TheraBand extension as well. So her phase 4 was her aggressive phase, which lasts 10 to 12 weeks. Our goals were to increase strength of deltoid by 25%, return to full participation without pain by the end of the 12th week. Our treatment was to do curtsy lunges, which also mimics the bowling movement. Side lunges as well with lateral raises with weight, which is just like a movement like this, working on her lower body strength. Ball toss on a Bosu ball trampoline for time, which is also helping on her bowling form and her proprioception due to trampoline. We have her, and at last we had her bowl with a medicine ball, 2 cones in the clinic, just to get her going and trying to get her back to full return to play.
So since she only got 24 visits with her insurance, it usually doesn't cover very much with our therapy. We kind of had to progress it a little bit more than we would want to, because it could last up to about a year. So what we did is we came up with a home exercise workout program for her that we gave her to take home with her, so that if she felt that she was her pain started to come back, or she started to have limited range of motion, she could do these exercises to help improve it. And we also wanted to get her back for her bowling tournament that was in Vegas. She was super excited about it. She kept talking about it. And so it's about a couple months from the end of our therapy away with her friends, and so she wanted to get back there bowling with them and have a good time.